US Senator Ed Markey joined today with healthcare advocates and consumers to voice concerns about President Trump's nominee for the US Supreme Court. This morning at the JFK Federal Building, they spoke about how the appointment of Brett Kavanaugh could affect reproductive health care and access to affordable insurance.
We're going to go back to the time when people they broke something, they were sick, they had a problem, they waited until it was absolutely gaspingly bad, and then they went in, and then in many cases it's too late, or it cost even more than what it would have if they had gone initially. Gutting this, ending this program would be really a crime against humanity.
Since the ACA was enacted in 2010, its opponents have tried time and time and time again to have it repealed and to erode its protections. And they have relied frequently on the judiciary to help them, most notably in the 2012 Supreme Court case, but also in other cases that have come before the court. With a Justice Kavanaugh on the High Court, the ACA's proponents will likely prevail.
With a Justice Kavanaugh, women's freedom to make decisions about their bodies, protections for Americans with pre-existing conditions, free preventative health care, and much more are at serious risk. We cannot leave the fate of Americans' health care in the hands of Brett Kavanaugh.
And to hear more about the healthcare issues that could be affected by the future makeup of the U.S. Supreme Court, we turn to one of the advocates we'd like to welcome, the Director of Policy and Government Relations at Healthcare for All, Brian Rossman. Thank you very much for being with us.
Thank you. It's great to be here.
Brian, in Massachusetts, we had near universal coverage before the Affordable Care Act was passed under President Obama. So if something changes with that act under the court or under President Trump, does that mean things will change that much in Massachusetts necessarily?
Well, some things could, and probably other things would stay the same. The biggest worry for us is what happens if the Medicaid expansion goes away and the federal tax credits that support the Connectors program, Connector Care, go away. So we had something similar before Obamacare passed under the old Romney program, but those were funded with federal money. And what we worry is that if the federal mandate, if the federal authorization for that funding goes away, there's no way the Trump administration would approve a waiver, which is what we had in the pre-ACA days under the Obama administration. We had a waiver to do these programs, and that would go away. So the potential loss of coverage is really significant.
Well, one thing that we know about Brett Kavanaugh in his decisions is that he tends to say things like, well, unless Congress said otherwise, we should stick to their directive. And what about the Affordable Care Act?
We don't know for sure. We'll have to see what cases come up. But throughout his judicial career, he's been very much looking to narrow the goal of federal government. He doesn't like looking at the intent of Congress. He likes looking at the kind of very narrow reading of the statute, the way it's worded. And he's very suspicious of just government telling people what to do. What I heard today is he's a classic conservative judge, which means he's doesn't want to look to expanding government programs for government to provide a role in helping people. So we're certainly very concerned about what this could mean if he were to be on the court.
Well, in the Affordable Care Act, there are two key provisions. One is the individual insurance mandate. Everybody has to get some kind of insurance.
Right.
And the other is that you cannot refuse to insure somebody because of a pre-existing condition. Now, under the tax reform passed recently, that individual mandate is no longer there. So where do we stand with the two pillars of the ACA?
Well, that's the case. So the state of Texas has brought us a case that's working its way up to the Supreme Court. They would say once the mandate is gone, the whole law should fall. And the Trump administration, interestingly, doesn't defend the federal statute here, which is unprecedented for a federal administration. And they're claiming that the protection for pre-existing conditions must fall too. So that case is in the district courts. It's going to work its way up to the Supreme Court. And if Judge Kavanaugh becomes Justice Kavanaugh, we certainly worry that he could rule with the Trump administration and against the ACA. I got to say, add to that, luckily the state of Massachusetts has stepped in defending the federal law along with a bunch of other states.
Now, another thing we're hearing about Kavanaugh in the other direction is that he laid the groundwork for a Supreme Court decision that upheld the ACA.
Well, yes, in a footnote, he said that if we were to uphold it as a tax, that could be possible. And in fact, some very hard conservatives are angry at him for somehow being pro-ACA. You know, we don't see it that way. His general judicial philosophy is to reduce the role of government. He's against the government sort of getting involved. And he's very much against grants of authority to federal agencies. His sort of way he sees things is if the Congress didn't write it directly, they're not allowed to do it.
Now, there was another decision that he ruled that the mandate for coverage of contraceptives access was in violation of religious liberty, at least in the case of religious orders who were the employers.
But it wasn't the contraception itself, it was just the paperwork that had to be filed by people to get out of the requirement. So Congress allowed an exception, a religious exemption, from the contraceptive requirement. And it just required employers to fill out a little form. And he said just filling out that form was a violation of religious liberty. So once again, I think the women's groups that we work with and people like us who are concerned about reproductive rights also have a lot of reasons to be worried.
This is BNN News, and we're talking with Brian Rossman from Healthcare for All. Brian, speaking of reproductive health rights, there was a very controversial decision, Kavanaugh, at least a dissent that he wrote in connection with an undocumented 17-year-old female who was trying to get an abortion while she was in detention. Explain that case.
So I'm trying to remember the details, but it was really, the sort of humanity went out of his decision, to be honest. And he looked at her just as somebody who may or may not have rights and kind of ignored the reality that this was a young woman who needed an abortion, otherwise was going to be forced to carry a baby to term, and that she didn't want. And because she was undocumented, somehow her rights evaporated in Judge Kavanaugh's opinion. So we were certainly disturbed by what he had wrote there.
Now, what about Roe v. Wade? This is the fundamental precedent-setting decision that sort of locks in at least a certain basic right to abortions. Do you see that really changing necessarily?
Well, two things I would say on that. One is when President Trump took office, he said his absolute litmus tests were two things. One was repealing Affordable Care Act, his litmus test for judges, for justices. One, repealing the Affordable Care Act, and the other was overturning Roe v. Wade. So that gives us a lot of pause right there. The second thing is he very much is not into sort of an expansive reading of rights. And so Roe v. Wade sat on the foundation of the right to privacy, which all people have under the majority of the Supreme Court. He doesn't see it that way, and so by not reading into the constitutional right to privacy, which most people agree absolutely is part of the constitutional arrangement, it would lead him possibly to overturn Roe v. Wade. These Supreme Court cases are all very close. A lot of them are 5-4, and were he to replace Justice Kennedy, what it could mean for Massachusetts and for the country really worries us.
Now, of course, I'm also hearing from some quarters that if Roe v. Wade goes down, it's not going to be in a single knockout blow. There are going to be these little things, all these little knife cuts.
Well, what they'll be doing is allow states to pass their own state laws, and so there are laws at the state level about fetal viability and how many weeks, and having to go to a doctor, or can't go to a hospital, I can't use a clinic, and so on. So there probably will be these cuts, but we don't know, and the risk, I think, is really great.
Now, of course, when you're talking about Brett Kavanaugh here. If for some reason he were to be, rejected or withdrawn, Trump is going to nominate another judge. There's going to be another Trump nominee. It's probably going to be someone who would go pretty well over with the Federalist Society. So, does it really make much difference? Well,
the Senate has to look at the justice that's nominated, and this is Kavanaugh. If they decide it's not appropriate, he's not the best person, then they should reject him and see somebody else. But you're certainly right. Nobody knows what the future will bring. The Senate makeup could change, and that would be a difference. We want to see a justice nominated who's a moderate, who can look at these issues from a broadly expansive point of view rather than a narrow point of view, to reflect the broad understanding of our Constitution, for today and not from 100 years ago or 200 years ago.
Thank you very much for being with us.
Thank you so much.
Brian Rossman from Healthcare for All.